Welcome back, everybody. It's time for our last segment of Ask the Expert. Scott Watson's here from Watson's Pharmacy and Wellness Center. We do have a few questions coming up, and we're going to get to them. People should explore the idea of alternatives to relieve their pain. Should they not? Like, it's worth checking things out because you never know what will work for you, right?
It's true. I've seen people take, we talked about antioxidants, and certain people just tried this one called astaxanthin, and it's helped with chronic inflammation, chronic arthritis.
Yeah.
And I think it's worth a try. They're just simple little nutrients that don't seem to have too many side effects.
It could work for you.
It could.
All right, first question in this segment. Margaret is on the telephone this morning. Margaret, hi, how are you?
I'm fine, thank you.
Good
How
morning.
are you?
Very good, thanks. What's your question today?
My question is, I have just recently undergone a total knee replacement.
Right.
Oh my goodness.
And one of the things that occurred was I had a significant drop in my hemoglobin
Okay.
from about 130 to 85.
Okay.
And I'm trying to rebuild my iron or my hemoglobin back, and I wondered if the doctor would have any suggestions. I am taking a supplement called Floradix,
Okay.
which is liquid iron,
That's right.
and wondered if there are other things that I could do to help get my energy back.
Well, so iron supplementation is the mainstay for these types of issues where people lose a lot of blood, and doctors will talk about Floradix, which is ferrous gluconate, a pretty well-formed, well-absorbed form of iron. There's other ones. If that doesn't seem to be doing the job for you, I mean, that's a very good choice. But there are many others that doctors, hematologists have talked about. Proferin is one of them.
Yeah.
And that's just another better absorbed form of iron that might be good for this woman.
Right.
In addition, B vitamins can help with that. Folic acid I've seen help with that. So do talk to your doctor and pharmacist to see if there are other things that you could add in there. And if this product, if you've been taking it for a while and just doesn't seem to be working, there are other iron products that can be tried.
That's right. That's right. Okay.
Okay.
Next up is Errol from Ottawa. Errol, good morning. How are you?
Good morning, Kurt.
Good morning. What's your question today?
I have been diagnosed with plantar fasciitis in my right heel.
Ah, yes.
I followed all the directions from the doctor with the cold treatment, rolling of the feet, the free stretches in the morning. But it still persists after 3 to 4 months now.
Well, I tell you what, Errol, I can help answer this question because I went through that last year, and one of the things that I found most effective was taking a small ball, in my case a golf ball, and rolling it under your foot in the arch and all the way back to the heel and putting a little more and more pressure on it, and it seems to stretch things out enough because that's really painful, Errol. You know what I'm talking
Absolutely.
about. But that will help you, but there are other pain medications, I'm sure.
In many pain regimens, there is that component of physiotherapy, right? So seeing a physiotherapist or a massage therapist can really help these types of inflammations of tissue that are causing that pain. In terms of medicinal, I mean, we can always talk about, the anti-inflammatory properties of antioxidants. This type of product that can be applied to that area that's very painful.
And that's just topical, a cream, right?
Just a topical cream that has the anti-inflammatory properties, and it's very useful. So something like that might be an option. We've even compounded anti-inflammatory creams for these types of problems for patients. Prescription anti-inflammatory creams that you could rub to the area, and you're going to take medicine across, and that's a very effective as well.
Right. Believe me, Errol, that will go away if you keep working at it. I know it seems like forever.
That is the truth with any type of inflammation. It's just you got to keep going.
Yeah, you got to find the thing that works properly for you.
It does take time.
Yeah. We have one more caller. Shane is calling in from Cobden this morning. Shane, good morning. How are you?
Good morning.
Good morning.
You got a knee problem, I hear, Shane?
That is correct.
What's your issue?
I've got a torn meniscus in my left knee, and I've been trying to take care of it with Tylenol and Aleve. And as you said, Kurt, you don't like taking those things.
Well, not constantly, eh?
So
Shane?
I'm just wondering, is there another product, natural or not,
Well,
to look after that?
When I was just entering university, I had a torn meniscus, and I just remember that sharp pain that can happen if that little meniscus flips over.
Yeah.
And what helped me was actually getting in and having that snipped away so that it wouldn't do that. So
it's a minor
that might be an
surgical
option
procedure,
that you and your doctor can discuss. In terms of anti-inflammatory agents, there's all these nutrients, turmeric, antioxidants, again, fish oils. These types of things can provide that anti-inflammatory activity. A product like this might be suitable because that meniscus is close to the surface of the skin, and you can just target where you're getting that pain, and it's going to just carry these anti-inflammatories right to the site.
I would suggest then that when it comes to this, and I know I've got to do the same, is work with your doctor and work with your pharmacist. And,
absolutely.
And find different ideas, things that might end up working for you to relieve some of that pain while you're, you may be waiting for, in Shane's case, maybe he's waiting for a small operation.
That's
or
right.
what have you. There are ways to work through this. So I'm just getting started, so I'm going to try that.
Yes,
that
I think it's worth a try.
pain relief topical cream, see how that goes, and go from there.
Sounds good.
Yeah, but get in touch with Scott, and he can help point you in the right direction if you have questions. That's what pharmacists are there for, and they're really good at what they do. There's no question about that. Watson's Pharmacy and Compounding Center. I like a compounding center because you're still doing that.
We are.
Yeah.
We're doing more and more. It's great.
Main Street and Wellington Street. There's the website. Scott, thanks once again. Good to see you.
Thank you.
We'll see you next time here on Ask the Expert. We'll be right back.